The Movement Assessment Battery for Children, 2nd edition, presented by Jennifer, Meagan, and Riane. The MABC is a tool that identifies, describes, and guides the treatment of motor impairment. It is used to assess children's motor skills, disabilities, and determine intervention strategies. It is individually administered. It takes about 20 to 40 minutes to complete and can be used within the age range of 3 to 16 years. It provides screening, assessment, and management for children with motor skill disabilities. The Movement ABC 2nd edition has 3 components. The first is a standardized assessment that takes 20 to 40 minutes to administer to ages 3 to 16 years and 11 months. It's delivered individually, and the client must perform a number of motor tasks in a specified way. It tests for manual dexterity, aiming and catching, and balance. The second is the checklist that takes approximately 10 minutes to deliver. Ages 5 to 12 years old can be tested individually or in a group, and this observes how children manage everyday tasks at home and at school, and it receives input and views from parents and teachers. Finally, the third component is the Ecological Intervention Manual, which is a manual that links interventions to assessments and provides a step-by-step guide to help develop interventions for children with movement difficulties. Motor movement difficulties, whether mild or severe, can impact and distress a child and their family. Both the MABC standardized test or checklist can be used to identify a child who has motor challenges by comparing the child's score to the normative data. However, neither instrument should be used on its own as a predictive screening instrument. Clinical exploration and intervention planning. Deciding how to help a child who has motor difficulties requires a different strategy from simply identifying that a difficulty does exist. The examiner must think beyond the profile of the child's motor competencies to include all relevant aspects of his or her development. For example, does the child have issues with attention as well as motor difficulties? The Movement ABC provides the examiner with the opportunity to record a range of aspects that systematically affect the child's behavior. When combining the data from both the standardized test and the checklist, a practitioner can create an individualized intervention program with both short and long-term goals. When evaluating a program in a child's motor performance and progress, it is essential that a reliable and valid assessment be used. The MABC serves this need in a playful and engaging way while allowing the practitioner to document and later analyze the child's changes in motor performance. Also, it is already well established as a research tool. It is used to select subjects for experimental study, as an assessment instrument in longitudinal studies of children known to be at risk of motor difficulties, as a means of studying the factors contributing to poor motor performance, and as previously stated, as a measure of change in intervention studies.
The Movement ABC2 can be used with children and adolescents with or at risk for motor impairments and delayed motor development. The assessment can be used in a variety of pediatric settings, some of which include schools, hospitals, outpatient clinics, or private practices.
The Movement ABC can be purchased for $1,000.50. It comes with all of the items here, including the beanbag, balance board, floor mats, pegboards, measuring tape, and timer, as well as other items. When you purchase the assessment, it'll include an examiner's manual, intervention manual, 25 record forms for each of the 3 age bands, which is 3 to 6, 7 to 10, and 11 to 16. You will need to provide your own chair and table of appropriate height. And the folks who can administer this test are occupational therapists, psychologists, physiotherapists, and pediatricians. People who can administer the checklists are also OTs, psychologists, but they can also have physical education specialists, teachers in special education, classroom teachers, speech pathologists, physiotherapists, and pediatricians.
When performing the movement ABC, there are some things you want to consider when preparing for the assessment. First is preparing the testing room as well as setup. So we recommend that this test be given as an individual assessment just to help build that rapport with that child and minimize any distractions. However, this is not a requirement. You want to wait at least 3 months of interval between assessments if you're going to retest the child. And then also having the optimal environment for the test. Have good lighting, ventilation, space, free from distractions. For some of the aiming and catching and balance, they recommend having a 6 meter by 4 meter space to be able to perform this in. So the test should be given in order as it is on the manual. However, this can be modified based on the examiner's clinical judgment. An example of this might be the examiner changing the order to maintain the interest or motivation of the child or to avoid those feelings of failure so they can continue to participate throughout the assessment. The testing time for this takes 20 to 30 minutes, however, can take longer depending on the child's motor difficulties. So to calculate the child's exact age, you would take the date of the test and subtract it by the date of birth. The example given above is the child you'll see later in the video, who is 12 years, 6 months, and 19 days old. So to do this calculation, we had to borrow 30 days from the month to perform the calculation accurately as shown above. So some other things to consider other than testing the room and setup is the clothing the child is wearing, making sure it's not too baggy, it's going to be in the way, too constrictive, and safety considerations around the room. Make sure there's not anything breakable, nothing that can cause any injuries. Here are a list of all the tests performed in the movement ABC, broken down by age band and components. As you can see, there are 3 components under each age band: manual dexterity, aiming and catching, and balance. Later on, you will see a child in the age band 3 perform 1 assessment from each component. So before the assessment is performed, a demonstration is provided, and the child is allowed a practice phase for each test. For all manual tests, a maximum of 2 formal trials are allowed. For all tests requiring a ball or a beanbag, 10 formal trials are allowed. And for all balance tests, static or dynamic, a maximum of 2 trials are allowed. If the child achieves the maximum score on the first trial, there's no need to perform any other trials. Once the formal trial starts, the tester may not help the child. If the child commits a procedural fault, that should be noted as a failure on that trial, and then they can perform another trial. The examiner can remind the child of the appropriate procedure between trials, as this is not a memory test. If the child does not start or complete the task, the reason should be recorded as one of 3 in one of 3 areas. So F for failed attempt, they do not perform properly. R for refusal, or I for inappropriate, if their disability renders the task inappropriate. They have a physical or sensory impairment impacting their performance. Some tests require the child to perform on their preferred side and then on their non-preferred side. Here are a list of all the tests performed in the movement ABC, broken down by age band and components. As you can see, there are 3 components under each age band: manual dexterity, aiming and catching, and balance. Later on, you will see a child in the age band 3 perform 1 assessment from each component. So before the assessment is performed, a demonstration is provided, and the child is allowed a practice phase for each test. For all manual tests, a maximum of 2 formal trials are allowed. For all tests requiring a ball or a beanbag, 10 formal trials are allowed. And for all balance tests, static or dynamic, a maximum of 2 trials are allowed. If the child achieves the maximum score on the first trial, there's no need to perform any other trials. Once the formal trial starts, the tester may not help the child. If the child commits a procedural fault, that should be noted as a failure on that trial, and then they can perform another trial. The examiner can remind the child of the appropriate procedure between trials, as this is not a memory test. If the child does not start or complete the task, the reason should be recorded as one of 3 in one of 3 areas. So F for failed attempt, they do not perform properly. R for refusal, or I for inappropriate, if their disability renders the task inappropriate. They have a physical or sensory impairment impacting their performance. Some tests require the child to perform on their preferred side and then on their non-preferred side.
Scores are calculated based on the child's best performance for each skill assessed. Scores for the standardized test are based on a calculated standard score and age-based norm percentiles. Once scores are calculated, children are placed in a traffic light system. The red zone indicating significant motor difficulties, the amber zone which suggests careful monitoring, or the green zone which indicates no significant motor difficulties. The checklist is scored based on the total motor score for sections A and B. It is important to note that if more than 3 items are marked not observed, a total score cannot be obtained. Similarly to the standardized test, the total motor score is then placed into the red zone, amber zone, or green zone, but is based on the child's age.
Now that we understand scoring, let's see the MADC in action. We will see it being administered to a 12-and-a-half-year-old, typically developing male named Bradley.
This manual dexterity test is performed on the preferred hand and then the non-preferred hand. During this task, the child holds the board steady with one hand and places his other hand on the mat alongside the pegboard. When signaled, the child picks up the pegs one at a time and inverts them so that the other color is showing, and replaces them in the hole as quickly as possible. You start the timer when the free hand leaves the mat, and you stop the timer when the last peg is inserted into the pegboard.
After completing the test, the administrator will write down the raw score. In Brad's case, he took 22 seconds to complete the test with his preferred and non-preferred hand, which results in a score of 22 for each. Following the raw score, the therapist will use the manual to calculate what his standard scores would be based on his age. Based on the chart and his age of 12 years 11 months, his standard score would be 7 for his preferred hand and 9 for his non-preferred hand. Lastly, the administrator of the assessment will add the standard score from manual dexterity tests 1, 2, and 3 to calculate his percentile and zone.
In this aiming and catching assessment, the child stands behind a marked distance on the floor, 2 meters from the wall. The child will throw the ball at the wall and catch it on the return without it bouncing on the floor. The child will perform this with the preferred hand and the non-preferred hand. The child has 10 attempts to throw the ball and catch it. The examiner will record the correctly executed number of catches out of the 10 attempts. A catch does not count if the child steps forward over the line to throw the ball, allows the ball to bounce before catching it, or catches the ball by trapping it against the body or clothing. As you can see, when Bradley attempted this with his non-preferred hand, he had 1 drop. If this were his last formal trial, he would get a score of 9 out of 10.
Aiming and catching 1 is scored similar to the manual dexterity 1 assessment. The administrator will write down the correct number of attempts out of 10 for his best hand and the other hand. In Brad's case, he has a raw score of 10 for his best hand and 9 for his other hand. Following the raw score, the therapist will again use the manual to determine the standard score based on his age. Then aiming and catching 1 and 2 will be added together to determine his percentile and zone.
During the Balance 1 static balance test, the child balances heel to toe on the keels of the balance board for up to 30 seconds. Once the child has achieved their balance position, start the timer. Stop the timer whenever a fault occurs. The child has a maximum of 2 trials to maintain balance for up to 30 seconds. Record the number of seconds up to 30 that the child maintains their balance without lifting either foot off the board, touching the floor with their foot, shifting the boards out of alignment, or touching the bases of the board with the sides of the shoes. As you can see with Bradley's first trial, he lost his balance after 10 seconds and removed a foot from the board. So he was able to do a second trial. During the second trial, he was able to maintain his balance for the full 30 seconds.
Balance 1 is scored based on the best time from the 2 trials with a maximum of 30 seconds. Brad was able to stand on the board for 10 seconds for trial 1 and 30 seconds for trial 2. Therefore, we would use 30 seconds as his raw score. Again, raw scores are converted to standard scores based on age. Balance 1, 2, and 3 are added, and the percentile and zones are determined.
Let's look at the evidence for the movement ABC. We'll look at the reliability, validity, discriminative, and predictive properties. In 2007, Henderson and others completed a study with 60 children, 20 from each age band. Using the standard scores for the 3 performances of the sections, which are manual dexterity, aiming and catching, and balance, and also looking at the total test score, they found the correlations indicate reasonable test-retest reliability. In 2012, Wong and others found internal consistency for this assessment with a coefficient of 0.9 and 0.97 for correlation coefficients in test-retest reliability. The validity for this assessment appears reasonable, and according to the test manual, an expert panel unanimously claimed that the movement ABC contents and items were representative of the motor domain that it was intended to evaluate. The movement ABC has discriminative abilities as it can be used to identify the extent of motor impairments in children with developmental problems in motor. Now let's look at the predictive abilities of this test. Previous studies have used the MABC to predict the level of impairment and need for intervention of children with developmental coordination disorder. However, it should not be used by itself as a diagnostic tool. Now that we've learned about the MABC and seen it in action, let's dive into the strengths and weaknesses of this assessment. The MABC is an engaging test that can identify children and young adults of a wide variety of ages with motor impairments. Its standardized test was developed by leading figures in the field. Its checklist incorporates caregiver and teacher input. It also has a broad range of specialists that can administer the assessment as long as they're a level B. For weaknesses, the main weakness is that it lacks evidence supporting the reliability and validity, and further testing needs to occur to strengthen this. Practitioners should use caution when interpreting the results to make clinical decisions based upon the previously stated weakness of reliability and validity. It is time-consuming, and finally, it is quite costly at over $1,000. In fact, I believe it is the most expensive assessment that we have covered so far in this semester. Thank you for joining us as we presented the Movement ABC. We hope you learned a little something today about how movement can be assessed with children in your future practice. If you would like to learn more about the MABC, please take a moment to review our references on the next and final slide.